Hello there, everybody. Today I'm going to be making a video about sections 2.10, section 210, and 211 on medical services and reproductive health. So let's get to it. This is probably one of the ongoing struggles that developing countries are going to have as they get a larger population. Big issue here is access to medical services. And then when it comes to reproductive health, I mean, it's one of the basic things about population is that, one of the easiest ways to get a population to rise is reproduction. It's pretty simple. But in terms of maintaining health services for the older generation and health services for people that really can't help themselves, the access to medical services is going to be very important. And there's also a question in your notes about the United States and what essentially we could do better as a country. So section 210, medical services. Countries possess different resources to care for people who are sick. Developed countries use part of their wealth to protect people who, for various reasons, are unable to work. In these countries, some public assistance is offered to those who are sick, elderly, poor, disabled, orphaned, veterans of wars, widows, unemployed, or single parents. Annual per capita expenditure on healthcare exceeds $1,000 in Europe and $5,000 in the United States, compared to less than $100 in sub-Saharan Africa and South Asia. The high expenditure on healthcare in developed countries is reflected in medical facilities. Most countries in Europe have more than 50 hospital beds per 10,000 people, compared to fewer than 20 in sub-Saharan Africa and South and Southwest Asia. Europe has more than 30 physicians per 10,000 in the population, compared to fewer than 5 in sub-Saharan Africa. In most developed countries, healthcare is a public service that is available at little or no cost. Government programs may pay more. We're on to the next page. In terms of government expenditure, this is what the question in the United States is all about. We're going to get to that in a second, as soon as this bad boy loads up for you. Get that full screen action. Government pays more than 70% of healthcare costs in most European countries, and private individuals pay less than 30%. In developing countries, private individuals must pay more than half of the cost of healthcare. An exception to this pattern is the United States, a developed country where private individuals are required to pay an average of 55% of healthcare, more closely resembling the pattern in developing countries. Maternal care is especially important in many countries. The United States is one of the few countries that does not mandate paid leave for new mothers. Expenditure on healthcare exceeds 15% of total government expenditures in Europe and North America, compared to less than 5% in sub-Saharan Africa and South Asia. Countries in Northwestern Europe, including Denmark, Norway, and Sweden, typically provide the highest level of public assistance payments. So not only do developed countries spend more on healthcare, they spend a higher percentage of their wealth on healthcare. Developed countries are hard-pressed to maintain their current levels of assistance. In the past, rapid economic growth permitted these states to finance generous programs with little difficulty. But in recent years, economic growth has slowed while the percentage of people needing public assistance has increased. Governments have faced a choice between reducing benefits and increasing taxes to pay for them. In some of the poorest countries, threats to health and sustainability are not so much financial as environmental. So, a couple things to pick apart here. Number one, the United States, it really all comes down to that classic anti-tax feeling that Americans have. And as much as the United States is more along the lines of a developing country in terms of how much individuals have to pay for it, it's one of those things that as a country we have as part of our identity. Somebody's health and welfare is not a public expense unless you're really old or you're really poor. Really old Medicare, really poor Medicaid. Um, it's one of those things that, you know, compared to other developed countries in the world, that's pretty much how we're different. And it really all depends on who you talk to. I am a bit biased in this because my mom is a doctor, my sister is a surgeon, an OBGYN surgeon at that. So I'm biased when it comes to that national conversation. All right, moving on to section 211. This is reproductive health. All right. The crude birth rate, the CBR, has declined rapidly since 1990, from 27 to 20 in the world as a whole, and from 31 to 22 in developing countries. Two strategies have been successful in reducing birth rates. Number one, improving economic conditions and contraception. Economic development may promote lower birth rates in the long run, but some argue that the world cannot wait around for that alternative to take effect. In some developing countries, demand for contraceptive devices is greater than the available supply, so the principal family planning strategy is to distribute contraceptives cheaply and quickly. Bangladesh is an example of a country that has had little improvement in the wealth and literacy of its people, but, and as I transition over here, the two things that you want to write down in your notes for sure when it comes to reducing the birth rate in this country and all over the world pretty much, is to do two things. Number one, improve economic conditions. It was actually touched on earlier in the book, earlier in the notes when it comes to population futures. One of the reasons why China and Japan are seeing a reduction in births, and they're going to see a reduction in their total population, is because their women are choosing to work. So if you improve economic conditions and you allow women equal access to working, that's one of the ways that you can reduce the birth rate. The other one is just put simply, availability of contraceptives, family planning. All right, 61% of the women in the country, this is still talking about Bangladesh. 61% of the women in the country used contraceptives in 2013 compared to 6% 3 decades earlier. Similar growth in the use of contraceptives has occurred in other developing countries such as Colombia, Morocco, and Thailand. Rapid growth in the acceptance of family planning is evidence that in the modern world, ideas can diffuse rapidly, even to places where people have limited access to education and modern communications. The percentage of women using contraceptives is especially low in sub-Saharan Africa. So the alternative of distributing contraceptives could have an especially strong impact here. Fewer than 1/4 of women in sub-Saharan Africa employ contraceptives compared to more than 2/3 in Asia and 3/4 in Latin America. Regardless of which alternative is more successful, many oppose birth control programs for religious and political reasons. Adherents of several religions, including Roman Catholics, fundamentalist Protestants, Muslims, and Hindus, have religious convictions that prevent them from using some or all birth control methods. Opposition is especially strong in some countries to terminating pregnancy by abortion. It's still a hot topic here in the United States, actually, in terms of the abortion question. But again, in terms of the larger scale impact of like reproductive health, abortions have been around for a long time. And whether you agree or disagree with the practice, one thing that you might want to consider is just the pure health of the mother at hand. And I'm not trying to make you think one way or the other, but we want to make sure that in this context, at least, um, you want to keep that in mind. So with that being said, that wraps up both sections 210 and 211 when it comes to medical services and reproductive health. I hope that was beneficial to you, and I hope you watch this so you can get educated and complete your notes. What are you going to do? Either way, have a good one. See you later.